Hi, everyone. Welcome to SimiTree's webinar. We're really excited that you could join us today. I'm Missy Gilliland, the Director of Learning and Development, and today I'm joined by two of the best experts in the business who are going to talk to you about revenue cycle and how you can really improve your processes. So with that, I'm going to turn it over to Cynthia to introduce herself and get us started here.
Good afternoon. I'm Cynthia Sikina. I'm the Vice President of Financial Strategy and spend a lot of time in this space. So I'm very excited to have the opportunity to talk to you about what I consider one of the key functions in an organization. My background is all finance for my entire career. 90% of it in healthcare in the last 15 years has been on the behavioral health side. Thank you.
Absolutely. Thanks, Cynthia, and happy to be joining you today. Hello, everyone. My name is Brian Harris. I am our Vice President of Financial Consulting. Similar to Cynthia, I've spent my entire career, coming up on 13 years now, in the revenue cycle and finance space, 10 of which with SimiTree. So really excited to talk with you today and really walk through. I'm going to keep coming back to that phrase, revenue cycle excellence. And really, what does that mean? So if we can jump to the agenda here, really what we want to be looking at and some of the learning objectives are, what are the best practice workflow items that are the keys to success? What we're going to start by doing with that is really defining the revenue cycle. I feel like every organization we walk into, you say revenue cycle, and everyone has a slightly different opinion as to what functions fall into that, what that means, what defines excellence. So we're going to start by really just walking through what we view as the revenue cycle, the importance of each function, and then really move into some of the common risk areas. It's very, very easy to have gaps in this. There's often a lot of players involved. There's communication breakdowns that could occur. So what we want to really talk through is, what are those potential risk areas? And also, how do we identify those? How can you set yourself up where it's not finding a needle in a haystack, that you're positioned through reporting and benchmarking and whatever you need to really identify those on a regular and timely basis? And I mentioned it a few times already, but the essential key performance indicators of what does that mean? And also taking a look, and we'll recommend this a couple times throughout, but benchmark against yourself, benchmark against your competitors, benchmark against everyone else in the country. I mean, you want to make sure you're not living in a silo when you look at this and look at opportunities to really streamline things. So we wanted to provide a few benchmarks that we use when we're really tracking, again, going back to that phrase, revenue cycle excellence. How do we define that and how do we really track that? So looking at those definitions, I always love looking at, on this slide here, the wheel. And I feel like is a really good descriptor of what we're looking at with the revenue cycle. I mean, again, from a summary standpoint, if we were to go the Webster Dictionary point by chance, it's all administrative and clinical functions that contribute to the capture, management, and collection of client service revenue. One of the misnomers, I feel like, when we always look at the revenue cycle is, okay, cash flow's struggling, it's billing. What's billing doing? What is billing not doing? Claims not getting out the door. Really, everything you see in this wheel to the right contributes to that revenue cycle and plays a factor in what your cash flow looks like, what your accounts receivable looks like. Are you seeing any write-offs? And we're going to go through that a little bit, but really want to focus on that in the revenue cycle. And the fact that, like we call out on the slide here, of everything flows into one another. If you look at this wheel on the right, a chink in the armor of any of the things that you see in this wheel could lead to the entire workflow falling apart or having gaps or seeing issues in some of those items that we mentioned with the cash flow and the accounts receivable. But when executed correctly, things flow smoothly, there's strong communication, and you really move through each of these parts in an efficient fashion. And if there are issues along the way, you've got communication that's really built up to communicate that back and forward. I think that's a key part of looking at this wheel here too, is communication needs to flow both ways throughout this. We'll go through the pieces at the front end of, hey, if there's poor communication at the front or we're getting insufficient information at the front, it makes it difficult for the back end to do their job. At the same time, if the billing team per se is seeing issues because of problems on the front end, that needs to be communicated back. It can't live in a silo of billing saying, oh, this is a problem, we'll have to work our way through it. Needs to be a two-way flow of communication as we work through this. So with that, again, I want to come back to the concept of the revenue cycle excellence. And Cynthia, I don't want to steal your words, because I know you speak about this a lot and have a really good perspective on it. So I wanted to pause there and see if there's anything you wanted to reference regarding kind of that term and how you looked to define it.
Sure. Yeah, when I look at revenue cycle excellence, I say it is the ability to bill and collect the correct amount for all services provided on a timely basis. It sounds like a simple sentence, but Brian, you're right. It's every single function in this wheel contributes to your ability to, again, reach revenue cycle excellence.
And that's an excellent point there, Cynthia. I like the way you phrase it too. And if we jump to the next slide, we'll start kind of walking through that. But it's a lot of these things that we talk about aren't going to be some mind-blowing thing that seems out of left field. I mean, a lot of it is relatively straightforward. I mean, we've built some processes with a lot of our clients that have worked in the past, but a lot of it is just making sure all of these things are linked up and having a steady and consistent view on the processes and really objective measures on all of these. So what we wanted to do is walk through each of the pieces on the wheel, give a bit of a background as to how we view that, and then we'll jump into some of the best practices that play out of a lot of these items. So starting with the PreVisit, I mean, this is really the start, the top of that wheel. And again, this is key. This is the point in time where that referral is coming in, you're capturing the information, you're doing the insurance verification. If authorization is needed, you're taking that step, you're getting the necessary demographics. You're really setting up the care for the client to make sure that everything we looked at on that wheel on top of the care delivery is really delivered effectively. So that is incredibly important in when your organization is looking at this, to make sure that you have everything you need at that point in time. We typically recommend a checklist of really walking through that and saying, hey, this is everything we need. And even if you can't get that for whatever reason, then you know there's an issue there. You know there's something that needs to be looked into, that you could have problems along the way. We also reference there, I mean, understanding your payer requirements and understanding, hey, what are the differences between the insurance verification and authorization needs for payer A versus payer B. Developing a level of a payer matrix that your team can take a look at and say, hey, payer A, I need to do this. Payer B, I need to do that. And there's no confusion as we're going through this pre-visit process. Again, this is really important. This starts that wheel turning. We keep going back to that metaphor of making sure you have all of the appropriate information needed to make the rest of the revenue cycle function successful. The next step in that is going to be the scheduling, and really scheduling that with the appropriate provider, making sure that based off of some of the payer and insurance requirements that you're utilizing providers with the right credentials, that you're setting yourself up that when you go to bill, that you're not going to risk rejections or denials or issues because of a misinterpretation of the payer's requirements or misinterpretation of the level of service that the client needs. Really setting that up and getting to the point of the services that we're actually going to be billing for, and making sure that the team is in line with the timing of that and everything that needs to go into that scheduling and pre-visit process. The third item that we have here, the check in and check out, is almost like a double check or just making sure everything that we've done up to this point is confirmed. And again, it's always good. You want those checks and balances. I feel like a lot with the revenue cycle, it's a mix of both having the checks and balances while not duplicating everything that was done in the past. If you have one person doing insurance verification, you don't want someone else doing the same exact insurance verification just for a check and balance. But this check in, check out, when that initial visit is starting, when you're developing the treatment plan, really making sure that you're confirming all demographic information. If there's patient responsibility, that's being understood and communicated. Scheduling any follow-up services in accordance with the provider instructions. Really, again, taking that initial visit and springboarding out of there and confirming, hey, everything we did in the referral process and the pre-visit, the scheduling process leading up to this, we're good to go. We don't anticipate there's any gaps. If there was a piece of that checklist that was unchecked when we went through the pre-visit process, we've got that figured out. And we know, again, with this first slide here, we refer to as the front end of the revenue cycle, we're setting up the rest of the players for success and giving them the information they need to really be successful. So we jump to the next slide. We start to get into the accounts receivable management, really starting with the charge capture. So all of the services, both initial and subsequent, you need to make sure that you're capturing a charge for all of those services, The one big thing we want to call it here is understanding with your EHR and understanding with how you're tracking this, is it gross or net? That could be a very big difference there and could drastically change how you're managing your AR, understanding the potential dollars that could come in, levels of reporting. We're going to talk about days of sales outstanding in a little bit. If you're using gross versus net, that changes the formula and what you need to look at your DSO, look at your average turnaround in terms of what you're getting paid. So that charge capture is very important. One, to make sure you're capturing everything, but two, that you understand that the charges that you're capturing, what those dollars really represent in correlation with what you're ultimately going to get paid. At that point, again, we mentioned billing at the top. This is an essential function of the revenue cycle and falls in line with the definition that we talked about in terms of revenue cycle excellence, but it's really getting the claims out the door efficiently and timely. I mean, at the end of the day, you can't get paid for a claim if it never gets sent. So making sure that your process for actually submitting these claims has, again, strong checks and balances in there, that if there's issues holding up those claims in the EHR or problems, whether it be process, documentation, technology that's preventing you from getting those claims out, that's addressed timely, and that things are getting sent on a timely basis. If you're getting denials from the payers, a lot of them can be disputed. There's certain things you can fix. If a CPT code is off, you can fix that. If you don't submit a claim timely and you're denied for past timely filing, that's a denial that's much more difficult to dispute and ultimately get paid on. So really important that the billing process is seamless in that regard, that it's done on a regular basis. And also, again, going back to what we had on the front end revenue cycle slide, everything that's happened up to this point sets up billing to be successful. In the era of it sounds simple but becomes more complicated, billing at the end of the day is doing a pre-bill audit and pressing the buttons in the system to get the claims out the door. I mean, if you boil it down to a 50,000 foot level, that's what we're looking at. But everything that we've talked about leading up to this point is what really makes billing successful and it allows us to achieve that timely submission basis. After that, I mean, life would be easy if you sent the claims, they got paid, and we're good. But denial management is a huge piece of this. I mean, there's going to be a portion of claims, regardless of how clean your processes are up to this point, that get denied or payments not received. So you need to have a team that's specifically focused to that. What we find a lot of the time is that there's teams that spend all of their time doing billing and charge capture, some of the pre-billing, and no time following up and doing collections. You need to make sure you have resources that are specifically dedicated to looking at these denials, determining whether they're valid and appropriate, appealing where necessary, understanding, again, hey, if we're going to write things off, how's that being communicated? How are we preventing these write-offs in the future? Really doing a root cause analysis. There should never be an example where we're doing this denial management and these collections efforts and we're seeing trending denial reasons where there's not a conversation that's had to say, hey, we're seeing this on 20% of the claims that are getting sent out the door. If we can fix X, Y, and Z, that'll get reduced significantly. It'll help cash flow. It'll reduce our AR. It'll reduce our write-offs. This denial management is a very key process, and we recommend making sure that you have sufficient resources focused on that, not just the initial billing of the claims. Potentially, some of one of the tougher pieces of the AR is the self-pay piece. I mean, again, there's a big difference between working with the client on outstanding co-pays, co-insurances, whatever it may be, and going to the insurance companies that we talked about earlier. You want to make sure that there's timely communication of that. If you can be proactive in communicating the expected balances owed by the client, it helps throughout the process. And then also making sure there's timely posting of that. The last thing you want is that clients are receiving statements for outstanding balances and they're like, I paid that 2 weeks ago. So making sure that you have a timely process there, good client services, and that you're working with them and from a follow-up perspective, working on the balances outstanding while being understanding of their position as well. Again, wanted to separate that out from the normal insurance follow-up as it's a similar concept. You got a balance on the accounts receivable, you need to follow up on it, but it's really a different approach that you need to take compared to the insurance companies. At the same time, cash posting is incredibly important. We look at that payment posting here, really timely and accurate posting of the payments. If you have delays in that, your AR looks inflated because you had a lot of things that were paid that haven't been reduced on the AR. It also impacts that team that we talked about that's doing collections because they could be following up on claims and going, oh, this paid, oh, this paid, oh, this paid. You want that team focused on the denials. You want that team focused on things that haven't paid, on the real issues. It's not the most productive use of their time if they're going through and just marking that things have already paid. we want to make sure we're doing this timely and there's a reconciliation with our bank account, that the AR is getting updated and that your collections team is working off of a current AR of things that are actual denial issues or long processing times for the insurances. That goes hand in hand, I mentioned it there, with the deposits, making sure there's internal controls in place for payments posted in the AR and a reconciliation in the bank account. You don't want to be scrambling at month end to figure out, does our EHR match what's going on in our accounting system? Did we post everything that's there? What is cash trending throughout the month? I mean, cash is paramount. You want to make sure you have a strong process that at a minimum on a weekly basis, you can be tracking to see cash flow. You want to be able to set yourself up where, hey, I'm halfway through the month. Normally I collect $1 million in a month. I'm at 700,000. Great, we're on a good trend. Or I'm at 200,000. What's going on? What are the issues? Why are we struggling to collect cash this month? That way you can start addressing those and identifying root cause and not have to wait for month end in order to figure that out. So timely posting of cash and reconciliation to the bank are paramount in those items. And then finally, closing this out, I mean, payer management. We talked about it a little bit. If there's erroneous denials, making sure you're maintaining relationships with those payer representatives. You have a way to work through some of these claims issues if the normal channels aren't being successful, but really understanding your contract terms. What are your rates? What are the pre-billing requirements? What is the authorization requirements? What is the timely turnaround for the payers in paying you? What is the turnaround in what you need to submit initial claims or corrected claims, whatever it may be? Monitoring communication for payer updates. I mean, understanding things at a payer level, and I'll go back to something we mentioned in the beginning of having a payer matrix that really lists all this out for your team is incredibly important, because you might have to operate a little bit differently based off of which payer you're working with. And it all really culminates with the month-end close. Again, making sure that everything we've talked about up to this point gives you clean and timely financial reporting to your organization, understanding where the potential gaps are and understanding where the opportunities are to improve. I mean, there's got to be really close communication between your revenue cycle teams and your finance team in this regard. But as you can see, and we've referenced throughout, I mean, all of this really ties together in some fashion. There needs to be communication both ways throughout that. So with that, I'm going to turn it back to Cynthia. Again, wanted to give a kind of base level of how do we define that, but that's great and all. Now what we want to talk about is where are the potential gaps and how do we mitigate them? So Cynthia, I'll turn it over to you.
Thanks, Brian. So when you think about the revenue cycle, and this is why I think it's one of the key processes in an organization, it does impact a number of things. Next slide, please. Certainly has a financial impact, because usually income from billing your clinical services represents the largest source of revenue to the organization. Your profit margin can be impacted by the mix of services and payers, again, that you're billing. Certainly, as Brian has mentioned, it affects cash flow. And there's a lot of payer incentive programs that you use your billing data in order to participate, which again brings additional revenue to the organization. Compliance. The documentation that reflects services provided and billed is subject to scrutiny and audit. Again, these payer rules, are you following the payer rules? Otherwise, you have to self-report that you did this wrong or that wrong. And most states have state and cost reporting requirements that you have to comply with. Quality impact. Payer quality measures, a lot of times billing data or the data captured in your EHR is used to qualify for these payer quality metrics. And billing data is often used to review provider performance. So you hear the term productivity, target, charges per month. So billing data becomes, again, very important in informing the organization. And of course, that denial management feedback loop, Brian, that you referenced is so critical. That's where you learn where we might have a weakness in a particular process. Oh my gosh, look at all these rejections or denials for no authorization. Okay, let's go find out. Is it a particular program? Is it a particular service? Is it a particular provider? So again, that denial information is so critical, because again, once you figure out why it's happening, that root cause analysis, you can do something to fix it. And that's where that bi-directional communication is so important. Next slide. Productivity. Again, this is where Usually your EHR data, billing data is used to track and report provider productivity, and even to look at the productivity of your rev cycle staff, of your payment posters, of your folks processing claims, of your AR follow-up team. And of course, your electronic health record. It can actually influence who you select as your vendor because they have functionality that meets a key requirement of one of your major payers. It impacts how you actually implement and set up your EHR. So again, you can take advantage of the features of the EHR that allow you to be in compliance with your payer requirements and submit those clean claims. And ultimately, it can help you optimize your EHR because you're going to find, oh, look at this denial. It's because of X, Y, and Z. Oh, look, my EHR has a way to flag this. We can add a pre-billing edit to identify these before it even creates a claim and goes out the door. So again, there's so much impact on the organization of those various processes in the revenue cycle. And so next slide. So a lot of times, if you can't answer yes to all of these questions, then there's room for improvement, whether it's process, how your EHR is used or set up. It could be a reporting. You've got all this data, but you don't know how to capture it into meaningful reports. And it ties right into that original statement I made about revenue cycle excellence. Are you capturing and billing all services provided? Are you collecting the correct amounts for all services billed? Are you confident that you're capitalizing on your EHR features that can improve the efficiency of your revenue cycle? Are you communicating effectively among clinical, front-end, billing staff? This is where the phrase "it takes a village" comes into play, because you cannot possibly keep that circle or that wheel turning unless everybody is doing their part. And of course, are you confident that you have effective management, operational, and performance reports? And and as Brian, you alluded to, there's so many ways revenue can leak out of the system. I think the phrase you hear a lot, I don't want to leave any money. I'm worried I'm leaving money on the table. I'd love to find that infamous table, but yes, we're leaving money on the table because guess what? If you're not verifying insurance, if you're not getting authorizations when authorizations are required, or even worse, you get authorizations for 10 visits and you schedule your 11th visit without realizing you need more authorizations. It's a big thing in the behavioral health space in terms of authorizations drive a lot of making sure your services will be paid. Again, those registration errors, bad demographic information. You'd be surprised how many people get date of birth wrong. Just billing errors, not reconciling your charges. Oh, here's all the services that were scheduled. Here's all the clients that actually showed up. Do I have a charge for every one of those clients that arrived that day? Making sure you're paid the correct amount. If you're underpaid or overpaid, both are bad. And then again, Brian, you mentioned denying those or appealing those denials when you have a legitimate reason to justify being paid. Next slide. And there's a way to monitor, there's a way to look at the health or evaluate the health of your revenue cycle. And these are the standard performance indicators for the revenue cycle. Your days in accounts receivable, what percentage of your AR is greater than 120 days, the net collection rate, and your denial rate upon first submission. So days in accounts receivable, very standard. You hear it a lot. Sometimes days sales outstanding is referred to in a few different ways. But it's basically taking your accounts receivable balance at any point in time and dividing by your average daily charges. So how long on average does it take the organization to collect its accounts receivable? And this is where, Brian, your point about understanding whether your accounts receivable is stated at gross or net. Obviously, the numerator and the denominator here have to be consistent. So if you're taking the contractual adjustment, the piece you agree not to be paid by the payer, if you're taking that contractual adjustment at the time of service, your AR is stated at net. So if your numerator is net accounts receivable, you want to make sure you're dividing by average daily net revenue, not your gross charges, not the $300 you bill, but the $180 you expect to collect from Blue Cross Blue Shield. The percent of AR greater than 120 days. What percent of your total AR balance is greater than 120 days old? Some folks use 90 days. It depends on your payer profile. In the state of Michigan, all of our community mental health agencies have a 60-day timely filing limit, if you can believe that. So for your organization, that greater than X days might be a different number, but in terms of AR greater than 120 days, the reason it's important to watch it is the older something gets, the more difficult it is to get paid. And benchmark for greater than 120 days, no more than 14.6 or 15% of your AR should be greater than 120 days. Net collection rate, it's a tough one, but it's extremely important. How much are you collecting out of what you are eligible to collect? So numerator, what you're collecting, actual collections. Denominator, what do you expect to collect? It's that $300 gross charge less the $120 contractual adjustment is the $180 you expect to collect from Blue Cross Blue Shield for that service. If you collect the $180, this formula would say you collected 180 divided by you expected 180. Guess what? 100%. Yay. I collected 100% of what I was eligible to collect. Benchmark, if you're at ultimate best practice, 97%. It allows for 3% bad debt, where bad debt is defined as I didn't collect something I intended to collect. It's not that contractual adjustment. You knew you weren't going to get that $120 because you agreed to accept Blue Cross's fee schedule as payment in full. So very important thing to monitor because it helps ensure that you are collecting the correct amount for your services. Denial rate upon first submission, I only have two clients that can hit this benchmark. This is, you should be able to when your first submission of a claim, not the rebill, not the secondary, but your percent of claims denied out of what you submit. And when I talk about denial, I'm not talking about rejections at the clearinghouse or rejections at the payer, but once the payer accepts your claim, if they turn around and say, oh, tisk, I'm not paying you because, again, timely filing, whatever, not a credential provider. If you can keep the number of claims denied out of the total number of claims you submitted to 4% or less, you are beyond amazing. And again, it's a tough benchmark to meet, but a really important one because, again, it helps with cash flow. Okay, next slide. Path to success. Think critically about what you do and how it adds value to the revenue cycle. Take out those non-value added processes. Be aware of key processes and technology that you use to perform the revenue cycle. Some of those manual processes and those cheat sheets you tape to the wall might be able to replace by something more efficient and more timely, if you will. Use standing meetings to discuss what works well, what could work better, what's broken and needs to be fixed immediately, so that, again, create that feedback loop among those players in the revenue cycle. Don't be afraid to ask questions. Why is this happening? Why isn't this happening? And identify those opportunities to benchmark yourself against both the industry and your own past performance. And reminding yourself that everyone in the organization contributes to the success of the revenue cycle. And knowing that to begin with is really one of the first steps, is making sure all the players on this team understand how they can impact your ability to collect for the services that you've provided.
Cynthia and Brian, that is great information that you shared today. Thank you so much. Any closing comments you want to share, Brian?
Sure. I mean, I'll even just go back to the last piece that Cynthia mentioned there is in multiple ways, you want to avoid silos. You want to avoid any of those items on the wheel being siloed from yourself internally. And you want to avoid siloing your organization from other like-minded organizations that are providing similar services, going through the same issues, whether it be within your state, within the country. I mean, leverage the community that's out there, leverage some of the resources and industry experts that you have. So, I mean, that's the only thing I double down on to what Cynthia said is break down those silos, both internally and externally, and that'll only help achieving a lot of the things that we talked about today, along with, I'm glad, always enjoy hearing Cynthia walk through that, having objective measures. It's one thing for your biller to say, like, yeah, it seems like it's going well, I'm not running across many issues, blah, blah, blah. But then you look and your denial rate's 40%. And it's like, okay, well, what you're telling me and what the numbers are showing are completely different. So let's take a look at this. So I guess just say breaking down silos and having these objective measures and taking action. It's one thing to pull data, but if you pull data and it sits on your desk somewhere, it doesn't really do you any good. Pull data and take action where necessary on those. And a lot of what we talked about today, I mean, there's issues, there's things that are fixable. It's just a matter of focusing on those and taking those steps forward.
Excellent points. Cynthia, anything else to wrap us up?
No, I think, again, it's a really important piece of an organization's financial health, and it deserves the kind of attention we're suggesting here.
Excellent. Well, thank you both so much for a wonderful presentation. If you have any questions or want additional information, Brian and Cynthia's emails are here. Feel free to reach out to us at SimiTreeHC.com. We'd love to hear from you. You will get a follow-up email that will include a link to the recording and the handout so you can reference this again in the future. We really appreciate you being here today, and we look forward to seeing you at our next webinar. Have a wonderful afternoon. Thanks, Brian and Cynthia.
Thank you. Bye now.
Thanks, everyone.